Okay, this is our examination room. No papers, no books, nothing to use. Okay, so as I enter the patient's room, I would provide for patient privacy by closing the curtain. I would perform hand hygiene in front of the patient and introduce myself. Hello, my name is Josie. I'm going to be your nurse today.
Hello.
Would you mind letting me see your wristband? Can you tell me your name?
Taylor Trouth.
And your date of birth?
12/1/93.
Awesome. Okay. How do you feel today, Taylor?
Good.
Great. Do you know why you're here?
Wellness checkup.
Wellness checkup. Okay. So, after asking those questions, I would move on to telling you that today I'm going to perform a general survey and then a cardiac assessment. And if you feel any discomfort at any time, please let me know.
Sounds good.
All right. So, first for the general survey, I would assess the patient's appearance. The patient is a female, Caucasian, and appears to be the stated age of 21. She is clean and well-groomed and is dressed appropriately for this appointment, the weather, and for her age. Her facial features are symmetrical with no visible deformities. And then moving on to her body build, the patient is a medium body build, the appropriate height for her weight. She's sitting comfortably up in her chair and is mobile if necessary. Also, for the speech, patient is speaking coherently. I can understand what she was saying as well as she can understand what I was asking. And also, I would assess the patient's mood. As I asked in the beginning, the patient was in a good mood, and I could tell by her facial expressions and her body language. And after asking the questions at the beginning, the patient is alert and oriented to person, place, and time. So, ending the general survey, I would now begin the cardiac assessment. And to begin the cardiac assessment, I would start with some subjective questions. So first, do you have any chest pain or tightness?
No.
Do you have any shortness of breath?
No.
Do you have a cough?
No.
How many pillows do you sleep with at night?
2.
2. Okay. Do you have any recent weight gain?
No.
Do you wake up at night to use the bathroom?
Nope.
Do you have any swelling in the legs or feet?
Nope.
Do you have any history yourself of heart problems?
No.
Do you have any family history of heart problems?
No.
Awesome. Okay. So that would end the subjective part of the cardiac assessment. Then I would move on to the objective. And first, I would inspect and palpate all cardiac areas. So first, I would start with the aortic, which is on the right side, next to the sternum, below the clavicle, at the second intercostal space. Then I would move over to the left, the pulmonic, which is at the second intercostal space as well. I would move down to the herbs, which is right at the third intercostal space. I would move then to the tricuspid point, which is at the fourth intercostal space, and then down to the mitral, which is at the fifth intercostal space, mid-clavicular line, so right about there. And after assessing all of these areas, I note that there was no presence of lifts, heaves, pulsations, or thrills. So then after assessing all the areas, I would assess the apical impulse, palpating with my fingers, and I would note that the apical impulse is a normal 1 to 2 centimeters in size. It was a normal short, gentle tap, neither diminished nor accelerated. So after assessing that, I would use my stethoscope, prepared equipment, to auscultate all of the areas that I just palpated. So I will start with the bell and first go to the aortic, which is at the right second intercostal. Then I would move to the pulmonic at the left second intercostal. And I would move to Erb's point at the left third intercostal. And I would move to the tricuspid at the left fourth intercostal. And then the mitral at the left fifth intercostal, mid-clavicular line. Okay, and then I would go back and repeat this with the diaphragm. Starting with the aortic, pulmonic, then herbs, tricuspid, and the mitral. Okay, and after doing that, I will now assess the apical pulse rate for 1 minute. And after assessing the apical pulse rate for 1 minute, I found that the patient's rate was a steady 62 beats per minute. And that is the end of the general survey and cardiac assessment.